So good evening. Welcome all to Johns Hopkins Bloomberg School of Public Health and the 14th annual Sandra J. Skolnik Lecture on Early Education and Advocacy. I'm Cynthia Minkovitz, Chair of the Department of Population, Family, and Reproductive Health, and it really is my joy this year to partner once again with my colleagues at Maryland Family Network to co-host this lecture, which honors the legacy of a true champion for young children, Sandra Skolnik. We extend our great appreciation to those of you who are here in the room and all of our friends who are joining us via Zoom remotely. For those who are joining remotely, we have muted your audio, but you'll have an opportunity to submit questions via the online link chat or to come off mute later. And in the last half hour, we'll have some robust Q&A, and we're looking forward to an interactive dialogue. And now I'm going to turn things over to my colleague who'll share with you a bit more about the lecture. Please welcome the Executive Director of Maryland Family Network, Laura Wheeldryer.
All right, good evening. It's lovely to see you all. As Cynthia said, welcome to kind of unbelievably the 14th annual Sandra J. Skolnik Lecture. Hello to all of our viewers on Zoom. And thank you for being here because primarily on Zoom, we are joined by childcare providers, and there is no way if you are providing childcare that you can get to the Bloomberg School of Public Health in East Baltimore at 5:30, parked and into this auditorium. So it is through the wonderful partnership with Cynthia and Hopkins that we can provide this hybrid lecture, and it really opens up so many more people being able to attend. So first, some shameless plugs. Everybody have a program? If you turn it over, you will notice there is a QR code on the back, and you may not have taken notice of this, but please do. This is a survey that will take you 10 to 15 minutes of your time, but it is to give incredibly valuable feedback to Maryland Family Network as we have just kicked off strategic planning, and we are looking for a wide swath of stakeholder feedback about what you value about Maryland Family Network, the priorities we should be working on, and you have the chance to give feedback that could impact our work and the lives of children in Maryland for a lifetime. Oh, the Zoom got muted.
People joining us remote can't hear you.
Okay. Let's try that again. Hello, Zoom attendees, and welcome. So we would really, really appreciate it if you would fill out this survey. We are seeking, as I said, a huge amount of feedback, and we'll factor it very seriously into the strategic planning process that we've undertaken that will last over the next few months. Next, if you are in person and you are seeking continued training hours, then you need to make sure you have checked in at the registration desk in the lobby. If you haven't done that, please don't do it now. You can do it afterwards. And if you are online and you need continued training hours, never fear, our staff will be following up with you after tonight's lecture. And thank you for that. So this lecture, as Cynthia has already mentioned, was named to honor the legacy of Sandra Skolnik, who was a visionary leader and champion for young children, their families, and their caregivers. Sandy was the executive director of the Maryland Committee for Children and a founder of Friends of the Family. Those are the two legacy organizations that merged into what is now known as Maryland Family Network. And I'm excited to say the Maryland Family Network is actually celebrating our 15-year anniversary this year. I know, crazy. How time flies when you're working on behalf of young children, their families, and their caregivers, or something like that. Anyway, of course, our legacy organizations have decades of history that precedes the merger, but just since the merger, it has been 15 years, and we hope you will keep an eye on our social media about exciting upcoming events and celebrations to mark this milestone. For those of you who don't know Maryland Family Network, let me share a few things about our work. Our mission is very simple. We ensure that young children have strong families, quality early learning environments, and champions for their interests. All of these components are critical for children's success in school and honestly throughout life. And I know that this is also your mission and it resonates with you as well, or you wouldn't be here with us tonight. So thank you to the dedicated childcare providers, the loving parents, the committed advocates from across the state, and everyone who fights for Maryland's children to have a better future. We couldn't do our work without you. So thank you. I'm pleased to welcome several people whose support makes this event possible. First, I want to welcome and recognize Maryland Family Network's Champions for Children and Build the Nest members. Thank you for being here. Thank you for your support. We're also very glad to have several members of Maryland Family Network's Board of Directors with us tonight. If you are a board member, would you please stand and be recognized? Thank you. We, of course, appreciate all of your support and commitment to MFN and families across the state. I would also like to welcome Delegate Alethea McCaskill. Hello, Delegate. Who not only is a leading legislator on these issues, but is also a committed child care provider herself. So double applause, really. And of course, thank you to the Johns Hopkins Bloomberg School of Public Health, which has been our dedicated partner for this event for 14 years. We appreciate the leadership of our friend and colleague, Dr. Cynthia Minkovitz, and her team, who work behind the scenes to make this event happen every year. So thank you, Cynthia. If it looks easy, it's not. So thank you. Okay. We are so pleased and honored tonight to have a special guest. When we started planning this lecture, we were thrilled that Dr. Catherine Edwards agreed to be our speaker, and you are in for a huge treat tonight. But before we even get to that, we have a very special guest, and that is our comptroller, Brooke Lehrman. She is the 34th comptroller of the state of Maryland and the first woman to serve in that role. Before her election as comptroller, she served for 8 years as a member of the House of Delegates. And while she was in the House, she was a fierce advocate for families and a champion for high-quality early care and education for all children. As comptroller, she has continued this legacy, and I would dare say built on it substantially in a pretty short amount of time. In January, she published a first-of-its-kind State of the Economy report examining trends in Maryland relative to the nation and to neighboring states. And one conclusion: the availability and affordability of childcare is a stubborn challenge, keeping women with young children out of the labor force. But I don't want to steal her thunder. I'm going to let her tell you all about that. So please join me in welcoming Maryland State Comptroller Brooke Lehrman.
Yeah, thanks so much, Laura. Thank you. Good evening. It is great to be here with all of you. Thanks so much for having me. And thank you, Laura, for that kind introduction, and Cynthia for hosting us and all of your partnership in this endeavor. Thank you. It's always great to be with fellow members from state government. So where am I? There. It's great to see Delegate Phillips and McCaskill. It's just wonderful that you could be here too. So good evening, everybody. As Laura said, I'm Brooke Lehrman. I'm honored to serve as the 34th comptroller of the state of Maryland, and turns out also the first mom in this role. So I am delighted today to be here to talk to you about an issue that I find both professionally and personally compelling. And I am no stranger to what it is like balancing the demands of juggling a full-time career and the needs of a family. And so on the personal side of things, I will note I live not too far from here in Fells Point and have 2 children who are 11 and 6. And when I found out that I was pregnant with my 11-year-old, Teddy, the first call I made was to my parents, and the second call I made was to a child care center to get on a wait list. I then called every other child care center I could find in downtown Baltimore to also add my name to their wait lists. But alas, 8 months later, I had not made it off of any wait lists. And so my husband and I, determining that we were not actually going to be able to find a spot, even though we could afford to pay, ended up needing to go the nanny route. And so we worked with friends and did a nanny sphere for several years until at the magic age of 13 months, when the ratio changes and there are more spots that are open, we were able to go then. So we have been through many childcare facilities in Baltimore City, all center-based. But I will also say we were lucky because, even when we had a nanny, which is, of course, a big expense. We had backup care provided through my husband's law firm, which was really a phenomenal opportunity that, of course, I think as an employer, his law firm recognized the need to offer something like that to its employees as a way of helping women and helping young dads and young moms come back into the workforce after they had children. And so even when our nanny had to call out sick or do something, we had a place that we could take our son to go stay. But I really share that story to emphasize the point of just how widespread this challenge is. It's a huge challenge for people who can't afford the cost of childcare, but it is also a challenge for people who can afford childcare, but there are not spots. And so I'm really excited about the lecture tonight. And as Laura previewed, we did issue this year the agency's first ever report on the state of Maryland's economy. And we found there that childcare was a key barrier, or childcare access, and the lack of childcare access was a key barrier to economic growth. So at a high level, we found that Maryland's economy is strong. We have low unemployment, and we have one of the highest median incomes in the nation. But our state is facing a number of challenges. We began experiencing slowing and stagnant economic growth starting in 2017, even ahead of the pandemic. And during the pandemic in 21 and 2022, we lost population in this state for the first time since World War II. And we found that is one of the reasons we are experiencing a labor shortage. Right now in Maryland, there are 3 job openings for every 1 job seeker. To put that in perspective, nationally, there are 1.3 job openings for every 1 job seeker. So it is much higher ratio here in Maryland. So high job vacancy rates paired with a low unemployment rate signals that our labor market is extremely tight. There's simply not enough people in Maryland to fill the jobs, let alone anticipated jobs for employers who want to grow. They are already having a challenge meeting their current demands, let alone thinking about future growth and opportunity. That really puts a strain on businesses, and it limits our economic growth. It also limits our state revenues. Because, of course, that is so singularly tied to what we are bringing in as a state. And part of the problem is that Maryland's labor participation rate decreased by 4 percentage points during the pandemic and has still not recovered. So that means we have lost about 181,000 workers who are no longer looking for work or working or participating in our economy. And one of the major factors in our labor force participation decline was women leaving the workforce. Now, I always have to preface this by saying women are not a monolith, right? Women left the workforce for many different reasons, but a key reason was lack of access to affordable childcare. I will say we know this from interviews, but also because of the demographics of the women who are leaving. 1%, so I'll say Maryland women between the ages of 16 and 34 saw a 2% decline in labor participation in Maryland. But nationally, women between those ages dropped less than 1%. They saw a less than 1% decline in labor force participation. So we are more than double the national rate. Of course, women in the workforce face steeper job losses and slower recovery than men because we are heavily represented in sectors impacted by the pandemic, including healthcare, education, and hospitality. But we also know through surveys that they were trying to balance work with caregiving and opted out of the workplace to fulfill their obligations at home. This balancing act comes at an extremely steep cost. Maryland is ranked as one of the most costly states in the nation for childcare. We know that because the Maryland Family Network helps provide important data that we cited in our report, revealing that childcare costs rose 20% between 2019 and 2023. And during that same period, childcare facilities and slots for children decreased dramatically, as we all know. And in fact, employment for women with children under the age of 5 decreased by 13%. Of course, 5 is the magic age when our kids get to go to kindergarten. And so that is very indicative of it. In fact, a couple weeks ago, actually, I visited a couple childcare sites run by the Critchlow-Atkins program in Talbot County. Now, Critchlow-Atkins provides preschool, before and after school care, as well as summer camps for children ages 2 through 12. And it keeps their rates for families in Talbot County affordable through strong fundraising efforts. They have the ability, they both charge tuition, but they then go out and raise money and spend a lot of time and energy raising money so that they can keep their rates lower. But even so, they'll be forced to raise their rates over time because the cost of everything is rising that much. So some families may feel a parent leaving the workforce is better than paying for childcare, but childcare is simply not just a women's issue. And it's important to emphasize that childcare is truly an economic imperative. High quality, affordable childcare and accessible childcare options, of course, provide our children with an important head start in life, which helps them later on and helps our economy later on. But also it allows parents to make sure that they can participate in the workforce in the way that they want, that they have the freedom to choose how they want to live their lives and participate in our workforce. And this, of course, builds a stronger economy for our state and for our nation. And we have someone with us here tonight who I am very excited to hear from because she has been digging into these issues for years and understands that the current system has failed us and failed parents and, frankly, has failed our economy overall. Dr. Catherine Edwards, she is an economist, a public policy consultant, and a writer. She's researched and written about labor markets, unemployment, childcare, women's wages, Social Security, retirement, and poverty alleviation. She's testified in front of Congress, advocating for federal childcare, the expansion of Social Security, and tax reform. She's currently a writer for Bloomberg Opinion, but more people recognize her from TikTok, which I do not have on my state-issued phone, where she posts educational videos about economics and public policy. Dr. Edwards earned her PhD from the University of Wisconsin, go Badgers, where my parents went, but her undergrad from University of Texas, where I went to law school, so hook 'em horns. And it is worth noting that Dr. Edwards is also a mom, so she is living out firsthand many of the issues that she'll be talking about here tonight. Please join me in welcoming Dr. Catherine Ann Edwards. Thank you.
Thank you.
Thank you, Comptroller Learman, for that introduction. I'm very privileged to be here and very grateful to have audience with all of you, as well as those who are tuning in online, who I know are many providers, without which my life would not be possible. You know, as I was preparing my remarks for this evening, I was struck by an article about childcare in the New York Times. Now, tell me if this sounds familiar. It was about how federal funds for childcare were going to expire. And Congress, shock of shock, did not renew them in time. The article had several quotes from care providers that came to the same conclusion. Once the federal money turns off, they will have to raise prices for parents. One provider said the cost would push out mothers who desperately needed the service. Another kind of bemoaned the fact that children who should be in her facility won't be able to attend anymore. I mean, I'm sure you've read something like this, or that you don't need to. The federal spigot turns on and then it turns right back off again. But what I thought was striking about this article was that it was from February of 1946. It ran the day before congressional funds through the Lanham Act, which funded childcare to support manufacturing production during World War II, were set to expire. They did expire. Now, a few states did the right thing for at least a few years, where they stepped in when the federal funds expired with state funds, but of course, all those funds turned off too, and the same article ran again. The money was coming from the government. It's not anymore. Prices will increase. Parents will drop out. Kids won't have the education. There's a really vivid image from this time period. It's from a march in New York City in 1947, and New York State was about to turn off its funding. Assembled, it's mainly a group of women. They're all impeccably dressed. They're wearing heels. Their children are in front of them, assembled almost like a sports team photo, and they're carrying signs that have a slogan repeated again and again and again. A permanent child care system is the state's responsibility. I don't think there's anything prophetic about their declaration. I think it's the truth. And it was true in 1943 when Lanham funds were allocated for childcare, the first federal spending for childcare in U.S. history. It was true in 47 when they were marching in the streets, and it is true today. A permanent childcare program is the state's responsibility. Tonight, I'll explain why I think that's true as an economist, a member of a profession with not the greatest reputation for being big-hearted. Maybe a little cold-hearted and cold-blooded, tend to come in with a bucket of water saying, here's why you can't do the things that you want to do, and here's the limits that we have in our actions. My assessment as an economist is that childcare is not only the state's responsibility, but it is one of the best investments we don't make in our economy, in our society. So let's start with the basics. The private provision of childcare is a market failure. That has nothing to do with the hard work, dedication, skills, commitment, and energy of the people who provide childcare. It's simply the numbers don't work out. A market failure means that private producers are unable to sufficiently supply a service at a price that consumers demand at the level the economy requires. Put differently, the economy needs childcare. There's not enough of it, and it's too expensive. That's a market failure. Nowhere is this failure more apparent than in the continued and sustained increases in prices that childcare have seen over the past 30 years, in which they've risen faster than housing, food, energy, medical care, and even that poster child of unsustainable prices, prescription drugs. Now, families who use private childcare can spend an average a fourth of their income on fees for childcare, which means that it can cost more than in-state tuition and mortgages in most states. That is a market failure. There's no way to spin it as adequate or accessible if that's how much money it's costing families for those who can't afford it. As a result of these high prices, many families have to find alternative versions of care, often a lower quality substitute. Friends and family who can keep a child safe, but often in front of a TV. It should be as alarming as it is disappointing that the quality of early childhood education that a child will experience is predicted almost perfectly by his mother's education level. Now, rich women will use their income to command the market to get the best for their children, while lower and middle income women will instead find that the market has power over them. That is a failure. Now, I think probably the most salient aspect of market failure for childcare for policymakers is that there is no market solution coming. Childcare is immune to market solutions or market improvements. There's no miracle technology waiting to be invented. There is no leap in efficiency or scale or how we deliver things or manage things that will suddenly and radically make it cheaper to provide childcare. There's no scale and provision, no assembly line, no AI, no management trick. Little children need the eyes, ears, hands, and attention of a capable adult. That will never change, which means childcare will never get cheaper to provide. Not only is this market in failure, it has no ability to right itself, to suddenly become plentiful or affordable, which means it's only going in one direction, which is worse than it is today. Since there is no way for it to become affordable or accessible, the only way for childcare to improve, the government must step in. So, why hasn't it? If childcare is so good, why haven't we intervened already? Well, I think a key reason is the misunderstanding of roles and responsibility. The closest that the U.S. has ever come to a permanent, fully funded federal child care system was in the waning days of 1971. Congress passed a bill to create a comprehensive child care and development system, only to have it vetoed by then President Nixon. Without enough votes to override, the fight was lost. In explaining his veto, Nixon averred he was fighting the, quote, family weakening implications of a child care system. The idea being that there are families on one side, the government on the other, and as the role and influence of the government expands, the role and influence of the family must therefore decline. You've probably heard this as public child care is having the government raise my kids. Well, what Nixon got wrong then, and what contemporary inheritors of that argument get wrong now, is that they are missing the biggest piece of the puzzle, the market. It is not families on one side and government on the other. It is families on one side and a failing private market on the other. And families are outmatched and they are outgunned. We do not want the government to interfere or intervene in the family. We want them to interfere and intervene in a market that is not serving any of us well. The decisions that families make, how much to work, what type of childcare they want, they are dictated by what the private market permits. That's control that they don't have. Can I take a job? Not if I don't have childcare. Can I switch a job? Not if it interferes with pickup and drop off. Let me tell you that. What if I want to go to a center that's designed around my special needs child? Well, not if it's full, or if I can't afford it, or if it doesn't exist. The government isn't intervening in the family, it's intervening in a market. Who gets a spot, where, and at what price? Those are market decisions. Those are not family decisions, but they should be public decisions. So, the private provision of childcare is a market failure. The market has no ability to right itself or get better, but will only deteriorate further. The government must intervene in this failed market if we expect any outcome, affordability, accessibility, or quality to change. So what would happen if they did? If the government finally stepped in and radically intervened into this failing market to make it instead a public service? The U.S. is an outlier amongst peer nations in that we spend so little on the care and education of children under 5. But that means that we have in hand a mountain of evidence of exactly what would happen and how our economy would be affected. So there are 3 well-documented and identified economic effects of having access to childcare. First, families have more money to spend on other things. This is largely a high-income, high-earner parent effect. Think of the families that are currently paying for good care. They're rich enough to afford it, but if they didn't have to, they wouldn't want to, and they would have more money to spend on other things. I consider myself lucky, even crafty, that in our nation's capital, just down 95, I was able to secure childcare for my children at $2,000 per kid per month. Now, DC also has 2 years of free preschool, which means in total, I will spend $72,000 on each of my children. The first economic effect of what childcare would do is what I would spend $72,000 a few times over on instead. Maybe that's a bigger house. Maybe that's savings for retirement or college or just savings, which I've read you're supposed to have. This part gets so personal. Or maybe I would just travel or spend it on other things or buy my kids clothes they don't need because it looks cute in a photo. But the first economic effect is empowering the economics of families to spend the money as they choose on something else that isn't childcare. That is a discernible and important economic effect. Of course, we don't actually know what size it would be because families would spend it on so many things. It's almost like subsidizing families writ large. The second economic effect is that more people would work. This is mostly a lower and middle income benefit. Think of families that a parent stops working when they have a child. Now, there's lots of reasons for parents to stay home, but access and cost of care is one of them. And that's one that we can change. Consistently, when free to near free care is offered to families, more parents work. Now, some might tell you that there's a very hard conversation that needs to happen here about what is best for children, if they are better off with a parent at home. I might come from one of the most arrogant professions on the planet. But I got to tell you, it would be presumptuous for me to tell someone how to parent their kid. What I would point out instead is that it is not a minority of parents who seek childcare. 2/3 of children under 5 in the US are in some type of non-parental care arrangement. They have voted with their feet. Parents want and need childcare. Some of them might prefer to stay at home, but some of them might not. And in this case, that some is the majority. I would also point out that the hallmark of a new free childcare program in almost every rollout I have ever studied in any country of the world is that it is immediately oversubscribed and more people sign up than they anticipated. Meaning it might be the case that whatever parents want to do with the offer of free childcare in front of them, they might just drop off that kid. Now, a parent moving from not working to working is a foundational economic change for a family because that worker brings home money. And an increase in income has few negatives for families, even if they're children under 5. And keep in mind, the labor market in the U.S. can be a cruel, unforgiving place. We've been in tall cotton for a few years now with a low unemployment rate and high number of job vacancies, but that is not always the case, and that is not a permanent state. It can be good, but it can be bad again. And the labor market can be rather unforgiving to someone who decides to sit out of work for 5 years, and they might have a very hard time finding a job at the earnings level to which they were accustomed. Now, many people do, but many people do not. So making it easier for a parent with the children under 5 to work for 5 years isn't just about those 5 years, but the next 35 years that they can maintain their labor force participation, maintain their earnings, and earn more over their lifetime. When I talk about childcare to policymakers, this is the most salient point. You think childcare is expensive for 5 years? Try missing out on 35 years of taxable earnings of a prime age worker. That starts to add up as well. It's not just a trade-off of 5 years we're talking about, but the careers of their parents. Now, I want to make a distinction here between parents and moms. I always say parents because families are different and moms take on a lot as it is, but there is a very important mom part of this story. Women and men don't hold the same jobs in our labor market, which means that moms and dads don't hold the same jobs either. And if a parent stays home, if a parent is pushed out, it is almost always the mom. The two most mom occupations in the United States, judged either by employing the highest number of moms or having the largest share of moms amongst their workforce, is nurses and teachers. Now, that's not surprising, but those are two professions that I cannot think of a locality in the United States as having an easy time finding right now. I don't think nurses and teachers and think easy to hire. No years-long job opening, easy to retain, easy to keep on staff. If you want more nurses and you want more teachers, you want more moms, and moms need more childcare. The third economic effect of having universally accessible and affordable childcare is likely families would have more children. Now, the evidence here is not necessarily as strong. We expect childcare to increase fertility, and it has in many instances. The caveat is that in some countries that have childcare, they are lower fertility countries in the first place with childcare or without it. And in fact, the impetus for childcare in many of our peer countries was not necessarily the labor force participation, but a rapidly declining birth rate. The U.S., until recently, was not a low fertility country, but is in the middle of a 15-year sustained decline in birth rates that is completely unprecedented. Every year since the Great Recession, we have been waiting for birth rates to recover in the United States, and they have continued to decline. The demographic ramifications will be larger than the baby boom that we saw 7 decades ago. The limiting factor for many families in having an additional child is cost. In a poll of parents with at least one child, in response to the question, "Why are you not having another kid?" 64% of respondents named specifically the cost of childcare. Now, they could select multiple reasons. They could select preferences for family size, housing constraints, career priorities, not wanting to get another car. but childcare cost was the only one that more than half of families selected. It comes at the start and it hurts, which means it affects fertility. So that's the economics of it. Should the government intervene in this critical but failing market, it would increase the consumption of families, increase the number of workers, increase the income of families with those added workers, and likely raise fertility. Intervention into childcare is an investment, but one with numerous avenues of proven economic return. There is nothing risky about this. There is nothing uncertain. This is not some kind of Hail Mary. We have all the evidence in front of us that childcare is the best decision we don't make. No doubt some of you, I'm sure providers who are watching online, are confused as to how I could talk about childcare for 15 minutes and not once mention children. Rest assured, the evidence abounds here too. Expansion of childcare would certainly result in higher quality early childhood experience and education for many children. Those from lower and middle-income families are poised to see the biggest educational gains, things like being more prepared for kindergarten with early literacy and early numeracy, more likely to catch delays and developmental milestones, whether they be educational, social, physical, or emotional. And expanding public childcare give those kids whose parents don't have command over the market the same opportunity of kids whose parents do. The work that many of you do on the proverbial ground, but on the literal ground too. Cross-legged, reading and singing and teaching and showing children not to bite and exploring colors and animals and sounds. It matters so much. It matters so much. I don't bring the effect of care on children as an economic return, though I suspect, especially in the long run, it would be the biggest one, because we shouldn't help children just to get something back. That's not the standard. Sometimes economic benefits aren't in dollars and dividends, but in making the economy a more just place. In this case, giving all kids the chance to benefit from the work that you do. Making something that is so clearly beneficial, something that is so clearly helpful for them in part of their development, a right for all children instead of a privilege for children whose parents can afford it. So forget markets, investments, workers, returns, participation, and go back to the same question I asked before. If childcare is so good, why don't Americans have it already? I think the other answer, the meaner answer, is actually found in the Personal Responsibility in Work Opportunity Reconciliation Act of 1996. In it, Congress ended the cash entitlement welfare program in the U.S., aid to families with dependent children, and replaced it with a temporary benefit that a parent may get if they met a dizzying array of requirements and their state felt so inclined. It was, as President Clinton promised it would be, the end of welfare as we know it. What is less well known is that the act also added on a lifetime ban. You couldn't get the cash benefits, even though they were temporary, even though they were conditional, even though they were subject to whether or not your state wanted to provide them. You could not get them if you had a drug felony. No equivalent ban existed for violent crime, assault, possession of a deadly weapon, or perhaps a more relevant crime like child abuse. It was just drugs. Are you poor and in need of help? We may help you, but not if you have a drug conviction. In the years after the bill, many states overturned this ban, many states ignored it, but it's not as if this were some other era, some time period so unlike our own, or that we've moved on to a place where helping children comes first and disliking their parents comes second. In 2022, just a few years ago, as Congress was debating a permanent expansion of the child tax credit, an expansion that halved child poverty, the holdout senator was caught on the record making what he thought was an off-the-record comment. We can't just give it to everybody. Some of these parents will go out and buy drugs. The economics of childcare is easy. It is open and shut with a mountain of evidence behind it. Is childcare a good investment? Yes. Does it have quantifiable returns throughout our labor market and our economy? Yes. Does it hurt the economy not to invest in it? Yes, again, open and shut. The economics may be easy, but worthiness is not. And it is the uncomfortable question and the uncomfortable answer that we have to face. My entire life, every politician I have ever heard spoken aloud has talked about the American dream, an economy and society of opportunity where there is equal chance of success for anyone who puts in equal amount of work. Is this dream achievable? Is it dying? Is it dead already? I'm always disappointed to see that none of them have the courage to bring up the truth. The American dream isn't dead. It's abandoned. We don't want it. Kids whose parents can't afford a high-quality early childhood education are disadvantaged for their life. They spend their early years in front of a TV instead of with an expert helping them develop. They don't have the same start. They do not have an equal start. Pulling yourself up by your bootstraps is simply a lot to put on a 3-year-old, and we know it, but we don't change it. The sad truth is the need for economic justice for children is outweighed by the need to have economic punishments for parents we don't like. But I am optimistic, even if for a pessimistic reason. Permanent public child care is coming, free or near free, universal, high quality. It's like they said in 47, a permanent child care program is the state's responsibility, and like it or not, the market is in failure and it will force the state's hand sooner or later. It cannot continue as is, and we will reach a breaking point, either one state or one federal government at a time. Which means there is a very beautiful truth that corresponds to that sad one. Economic justice, when it comes, will come from you, daycare providers. Giving your gifts and your skill and your time on the ground, one song, one book, one bite at a time. You don't just give families an economic break. You don't just give moms a chance to work. What you give is the start of the American dream. It is an equal chance of success at life, and one day politicians will recognize this. They will choose hope over fear. They will choose opportunity over punishment, and they will choose child care for all. Thank you.
I hope that felt like a call to action. Comptroller Learman, would you like to come up and give a response?
Thank you, Dr. Edwards. That was so illuminating and well said. So bravo. And I think you gave many of us here, all of us here, a lot to think about. A couple things that stuck with me. One is you took me back to 1996. I'm not sure where all of you were when the Welfare Reform Act was passed, but I was in the U.S. Senate. I was a page in the U.S. Senate that summer when the bill was passed, and people like Paul Wellstone stood up and said, no, this is not okay. This is going to hurt our kids and families, and voted no. And in fact, it was such a controversial bill that there was a protest in the gallery of the U.S. Senate. And people had to be removed from the gallery of the U.S. Senate as they were shouting, shame on you, shame, 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 as the bill was passed. So I will say, as a 16-year-old sitting there and watching that, it made quite an impression on me. And years later in Maryland, I was proud to sponsor legislation that actually helped remove the restrictions on drug convictions related to some of our anti-poverty programs, like our SNAP benefits and more that we provide in Maryland. So I'm proud that the General Assembly took us a while, but we finally started moving past the war on drugs. I also found, of course, the imperative that there is no market solution coming, and just how important it is for policymakers and for business leaders, for economists, for constituents to understand that fact. And when we all agree that that is a fact, as you said, that is when we will get to a place where we are stepping in even further, and government is problem solving rather than kicking the can. I'm very proud of the work that Maryland has done. So I give a shout out to our legislators here, to our Speaker of the House, Adrian Jones, and our Senate President, Bill Ferguson, and our governor. When we passed several years ago a child care scholarship program, thanks in part to advocacy from many of the providers on the call and many of the people in this room, thank you. And I think it's fair to say that that has been an unmitigated success. It has created opportunities for eligible families to receive access to high quality childcare and early education programs. It's helped buoy and support childcare providers as well. And in fact, if you want to get into the guts of government, those payments come out from my agency, the Office of the Comptroller. And we work very closely. There were real challenges in standing that problem up, challenges that were affecting our childcare providers who were not getting the payments that they needed on time and in a timely way. And so last year, our general accounting division in the state, which is in my agency, worked with MSDE to educate MSDE about what was necessary, what forms they needed, what was necessary to get from the providers so that we could process the payments and end up and balance our books. In fact, our general accounting division director, at several points when she was working with childcare providers to get them their checks, they would relay stories to her and her team of, not having food that week because they hadn't gotten the payment yet and they were counting on it. And members of my team brought food and groceries to providers they were working with who were waiting on payments until we got to a better place where we could process things more quickly with MSDE. So I'm really glad that we've been able to do that, but it's a continued struggle to make sure that we're streamlining the program. It's one thing to fund the program. It's another to make sure the program is working and meeting the needs of families and providers. And that is a continued effort. And I am grateful, though, to the General Assembly and the governor for providing the funding. And in fact, in the FY24 budget, there's $218 million additional dollars that were needed in emergency funding. And for FY25, they've allocated $328.5 million for a child care scholarship program, which is a huge deal and will go a long way. We obviously, there's much to do. We need to make going back to work an easy choice for parents and a strong start for the next generation, as Dr. Edwards said. So I just want to say thank you. Thank you for all of your work. I hope that some of you will take a moment and read our State of the Economy report at some point. You can find it on our website, marylandtaxes.gov. I will add one final point. I loved the point about nurses and teachers, because what we found in our latest report on the importance of immigrants to our workforce in Maryland is that healthcare workers are the number one, have the highest vacancy rate of any profession in the state. And so you can see how this confluence of events has all come to have us in this place where we don't have people to care for our loved ones who are in need of healthcare, because people who would go into that profession or who are of that profession do not have the support that they need to be able to go back to work. So thank you, Dr. Edwards, for so much school for thought, so much thoughtful content, and I look forward to continuing to work together to make sure we meet the need. Thank you.
Okay, we are going to move into a Q&A session, and let me tell you how it's going to work. If you are online, you are going to use the Q&A function in Zoom, and we have the lovely Laura Pierce, who is going to watch for questions and read them out into the room. We have Melissa and Tiara, who have microphones and will come to you talk show style if you have a question you'd like to ask. And while you're all thinking about it, I see you pondering, how are you going to dig in here? There were so many great points made. I'm just going to say, boy, did I hear a lot of echoes of MFN's work in your remarks. I think about how much we have worked to expand access and eligibility to child care scholarship, reimbursement rates to providers, streamlining the paperwork, much of which was punishing of the parents in the name of serving the kids. I don't know quite how that works, but the bottom line is, even so, we are only serving such a small fraction of the families who are eligible. So yes to all of the incredible work that has happened. Yes to thanks to the governor, the president of the Senate, the speaker of the House for record-breaking historic amounts of funding for this program. And how is it we are still not serving so many families? How is it that childcare providers cannot pay themselves a living wage? How is it that families still can't get access to childcare? So, I mean, I believe I'm quoting our speaker tonight when I say, I think this is a market failure. And it puts a lot of perspective on the work that we are all doing. So, okay, that was your time's up. You got to ask questions now. So I did what I could to fill there. You can just kind of raise your hand and the microphone will come to you. Flora T. Tiara, we got Flora right here in the second row.
The parts of office for the economy.
Not on.
Wait, there it is.
Oh,
Okay, so working out?
yes, it is.
So I know we've been saying for years about how the economy is so dependent on childcare for workforce issues, getting people in the workforce, getting them to do jobs that are needed, paying taxes, which raises, the economy. And then when children have good outcomes and become good citizens and also contribute, that's very important. And I know that, Marilyn, I'm so grateful for what the legislators have done, especially this year, in providing more funding and keeping the child care scholarship program going. I wonder if there's, with the money that was allocated for the coming years, is there going to be an increase in the amount of the scholarships for families? Because it was only this past year that for some families, when we had blended funding, where we had public pre-K funds like in my program, and they had a child care scholarship voucher that took care of the wraparound program, for the first time ever, families paid zero out of pocket. In prior years, there was such a big gap. They were paying $100 or $150 out of pocket. But now, like, here we come. The public funding and the microphone. Okay. And so I'm here. You can hear now? Yeah.
We're going to bring you the other microphone.
So I'm sorry, it's a very long question. I don't want to get that. So it's solid grade. Oh, there you go. Okay. So I'm just wondering, I know that when summer comes next month and the funding for the public pre-K ends, there's going to be a whole lot out of pocket for our families. And I just wonder if the funding that's been allocated is going to allow for increases between the cost of care and what the scholarship is now paying. That's my question.
Okay, I don't think I was the one who was supposed to answer the questions. First, let me see if there's anybody in the audience who would like to answer that question. Beth, would you like to take a stab? That's fantastic. Thank you.
Hi, everyone. I'm Beth Morrow, Director of Public Policy, and Flora is a longtime advocate and always asks questions that put me to work. Tonight being no different. Flora raises a good point. There's a difference between what it costs to provide quality care and what the scholarships pay. One of the latest endeavors that Laura is partnering with MSDE on is to undergo what's called a cost of care survey.
Why?
Check 1, 2.
Also, people could come up here to answer.
Child care providers across the state have been asked to respond to a survey where they will talk about how much it would actually cost to provide quality care. That includes their own compensation, the compensation for their workforce, and all the training and equipment and rent and all the things that add up to their budgets. I think that's one important policy step that the state is already undergoing to help address the concern that you raised. So thank you for raising that.
it's not a quick or easy answer, which I know is, I can see on your face as you want to know, like, well, when's that going to happen? Yeah.
But I think this is not.
Not immediately, no, for sure.
My name's John Meyerhoff, and I have another question that I'm not sure who's going to answer it.
Me either.
But so on the front page of the Sun paper yesterday, both Laura and Brooke were quoted about the increase in scholarships. But the other issue is supporting the child care providers, providing the infrastructure for that. And the child care resource centers have been left out of the increased state budgeting for the next several years. So I see a situation where there may be parents who have money to pay for child care, but there isn't child care available because providers are not being supported.
I mean, yes, that is very true. It was a wonderful article in the Sun. I want to point out Hillary Roberts King, one of Baltimore's premier child care providers, and her center's Downtown Baltimore Child Care Center was featured prominently in the article as well. And yeah, we're definitely very concerned about the child care resource centers and the work that they do in supporting the field. I was thinking about that a lot during Dr. Edwards' remarks, really, because it's the market failure has produced a very fragile ecosystem, and there are so many pieces that are interdependent and really need to move forward together. So we have in the United States a really compelling example in New Mexico where they have adopted universal child care. And what I have heard from advocates in New Mexico is that parents, I mean, just like Dr. Edwards said, like parents immediately oversubscribed the program. There was no supply, though. So they incentivized demand and parents signed up, but there were no slots to be had. So this is my point about the fragile ecosystem is one part of it can't move forward if all parts don't move forward, because you will end up with yet another market failure, I believe. So I would say stay tuned on the future of the child care resource centers, who do play a vital role in the state. And thank you for recognizing that. Delegate McCaskill?
So I just wanted to.
Wait, she's bringing the mic to you, even though I know you have a big inside voice.
Not from this person. It's dancing. Okay, so what I do want to say is to Flora G's question, good to see you. So we won't, unfortunately, be able to increase scholarship right now. But what we were able to do is help save families from being put on the wait list. And that was almost the inevitable of what we were facing for the scholarship program, and to help with having zero copay. Now, there are going to be some other wraparound pays that will have to be addressed. But what I will say is, hopefully in addressing Pillar 1 in the blueprint, and with the Enough Act being passed, which was a governor's priority, that we can help with the resource centers. We'll be able to address that through either of those, and we're looking at doing the interim of how that can be, how we can make sure that happens. The other thing we do need to make sure that we emphasize, and I'm pleading to our providers online as well, is that we get those surveys in, because we've been trying to get a market cost survey done for quite some time now here in the state of Maryland, and it's going to be a big impact as to how we in the legislation appropriate funds. So that might be my answer. So two things. I just want to do the kind of please.
We have several questions from our online attendees, and I will.
We let Dr. Edwards respond.
Oh, sorry.
I was told to come back up. I just wanted to say that from a non-Maryland perspective, the true cost of care, as outlined by the Administration of Children and Families as to how much to cost out care, no one does it. So DC does it. And I looked up their cost of care estimates before I came, and I was like, how could I possibly be getting a deal? But I am. But they just added to their cost of care model that providers who do family-based and home-based care have to pay themselves now. And so they had to include in their cost of care a salary for themselves, not just the overage of what they bring in. Michigan just did cost of care, but the state didn't do it. It was another network that did it to try to come up with their cost of care. So this is the direction, is to have this survey filled out, to have a very good understanding of how much it actually costs, not what you're asking for, but what you need. And if you fill out that survey and we move to this cost of care estimates, that is the next step to having this, the next step to having childcare funded is proving that we know exactly where the dollars would go. And that is what the cost of care models will help with. All right. Okay. Mine's ready. These mics really want us to keep things moving. Not sure, Kath.
Yeah, it's good. Okay, sorry, I was trying to get a mic that was actually working. So two of the questions are kind of partially already asked, and they kind of feed off of each other. One was asking about what is sort of the expected impact of the workforce exiting on the field of early childhood before we get ahead of it and get something like universal going. Like, what can we anticipate from an economic standpoint of when people leave the workforce, the impact it has on the market as far as availability? Like, are we going to see a loss and a negative impact on the providers as people leave?
So if I understand the question, right now childcare is too expensive and there's not enough of it. And that pushes people out of the workforce. So if people are pushed out of the workforce, that means they're not getting care. And so does that further deteriorate the market? I think it goes the other direction. I think the market affects the person and the person doesn't affect the market. Like, the market's already bad. They're leaving because they don't have care. And them leaving doesn't affect the actual existing market because they're not in it. They couldn't find their way. So the more families drop out, I will say that the caveat to that is that the way that the market is affected is that the more lower and middle income families drop out, the more that childcare becomes a boutique luxury good. Right? If the only people left are people like me, I pay a lot, but I could pay more because I would pay everything to make sure I could keep working. And providers are going to know that. And we're starting to see that with the influence of investment groups getting into childcare. They are not getting into childcare to help poor people, right? They are getting into childcare to soak people like me and say, well, we offer Mandarin, so now we pay $4,000 a month, right? And I don't care. I just need care. But the market is becoming a boutique good. And the more boutique it comes, the more it becomes kind of like, this luxury good for just wealthy people. And the increase of investment firms and venture capitalists moving into childcare is just going to accelerate the market away. So the effect of people leaving is really kind of coming the other direction. The market pushes people out, but part of the market's deterioration is just what it will become, kind of in the eventuality when it's just a wealthy person's good. Sorry to say that to providers. I know I'm not saying that offering Mandarin is bad. It's just kind of my thing of doesn't have immediate practicality for a 3-year-old, but a rich person would really want it for some reason. So it's just my kind of token. I bring up Mandarin lessons. I should come up with another thing, like sushi for lunch for children, something like that.
Well, good evening, everyone. My name is Scott Phillips, and I'll just use my. That's up. No, I can't get me on there. Yep, it died. All right, we'll try this again. So this is a very nostalgic moment for me. Having been probably the only person in this room who actually served on both boards before this organization merged, both Maryland Committee for Children and Friends of the Family. So it is a nostalgic moment for me. I haven't had to worry about childcare in 24 years. So that's another thought. This is the question, though, and I'm really challenged as we think about policy. we're working to increase early childhood education through a formal means, through the Department of Education. At the same time, we have a network. We have existing child care providers. And that seems to me, as we're changing this model and trying to increase to a universal child care, kind of making sure we take care of the existing infrastructure while we expand, that has always been a big tension as I look at it. What are you seeing about?
Yes. So yeah, you guys got to keep it tight. You got to keep it really short. These mics are not kind. Just mine. Isn't that funny? Well, now that I have 15 minutes uninterrupted response. So in Mandarin, I'm so sorry. There's a couple of ways to do it. I think that you know what makes sense from an educational perspective is to have preschool at the schools and care at the centers and family-based providers. And so I guess DC stopped halfway, but now has universal preschool for all 3 and 4-year-olds. And so you're extending down the elementary school into a classroom setting. And the difference there is what does it look like when the kid walks, more like ambles or rolls in the door? What does it look like? Well, in pre-3, it looks like a classroom, right? They're inside a school, they're in a classroom, they're sitting at desk, and they are there to do early childhood, classroom-based learning. That doesn't make sense for a 2-year-old. You're not going to keep a 2-year-old at a desk. And so sometimes it helps to have children guide the policy and not the other way around. Someone who is 3.5, turning 4, turning 5, they can benefit from a classroom experience, from getting practice as to what kindergarten and elementary school will be like. They can sit in a chair. Granted, my son's schedule, nothing lasts longer than 20 minutes, right? He's in school and the schedule is like this long because every 10 minutes they move on to another activity. And in between every activity is 10 minutes of transition, which I always call honesty. I'm like, there's no way they're going to get this kid from A to B and have 20 of them and be okay. But having the kids guided, I think, is helpful. And that the current care providers are set up for non-classroom care. And that would suggest that they're in kind of the 0 to 3 range. Maryland has already done a big part of solving this problem by having a paid leave program. And so now if you have a paid leave program that ends at a certain number of weeks, that's when care can begin, right? You're just kind of taking this big 0 to 5 and putting it into the most appropriate pieces at home with parents, in a care setting, in a school setting, off to kindergarten. That's not the best answer because it's really vague. But I think that what care providers do now so well is kind of introduce learning to what are kids, but what are also students. And I imagine if you had an actual rollout of, the magic money appeared from the state of Maryland and we have universal care here, you would probably see some centers become more infant-based and some centers opt to become preschools. And they would kind of just split it up based on what they would prefer to provide in-house.
Another online question kind of relates to what you just spoke about, is that how do we do this so that the impact of the public school doesn't impact? Because we're seeing that now. And one of the factors that was brought up in the question is that the cost for younger children is higher. And most current model childcare programs subsidize the cost for the younger children with the tuition for the older children.
Yes.
So if the older children are pulled out of the childcare setting and into the school system, where does that leave the childcare providers from a financial perspective?
Yes, that leaves them where DC is now, the most expensive place to buy childcare in the United States, because they don't have a large 3 and 4-year-old market unless you don't plan on going to public schools, in which case you're already paying top of market anyway. No, so this is why you one piece at a time does not suggest one piece 10 years after the other. The DC childcare market became incredibly expensive, mainly because they had lost their basically low-cost kids in many of the care settings. If you have a cost of care model and a survey in front of you, you need to talk about how more expensive infants are. Because if payment is going to come in, you need to be paid more if you have an infant than if you have a 3-year-old. And if a cost of care model is what you follow, then you would be paid by the age of the kid, not necessarily by the number of kids in your center. So if you look at DC's cost of care surveys, which they collect but don't implement, in Michigan's true cost of care survey, it's priced out by age. So it's 0, 1, 2, 3, 4, 5. And so they separate out the cost of care. So your center would be paid based on the age composition of the kids there. You have a bunch of kids age out and you get a bunch of infants, you would get more money because the care is driven by the age of the kid, because that we all know that dictates the cost. A compensated cost of care model would basically have that already built into their system because it's based on the age of the kid that you have for your care. So you would like tell the state, here's how many kids I have at what ages, and that determines your reimbursement. New Mexico is doing something similar to that.
Good evening. I'm Josh Michael. In our ecosystem in early learning, we have some programs that are designed primarily with the value proposition of increasing education outcomes. And we have some that meet the value proposition of providing high quality childcare. And when we do it well, we do both. In our context here, we have rich history, particularly in Baltimore, of Head Start. And we have policy focus. Most of the airtime right now is focused on pre-K expansion, which as it's structured actually is really, 6.5 hours a day. How are you talking about these kind of two value propositions when we think about the market? Some programs really aren't designed to support on the care side. And what thoughts or advice do you have as we're thinking about the market and programs that we're spending a lot of money on that maybe don't actually meet the market need for childcare?
So I don't know if I understand your question. So are you talking about Head Start, or is your question like childcare centers have a hard time doing it all? So how do we prioritize?
Well, I think the question is, we know that Head Start and pre-K, as we have it set up, actually, they do some help for childcare, but very few jobs allow you to drop off, go to work, come back in 6.5 hours. And the question is, from a policy lens or from an analysis lens, that's where the money's going in our context.
Right.
Money, with the exception of the work that's been done around childcare scholarship. How do we merge these conversations? Because right now people are saying pre-K is helping working moms, but it's really not. Without patches.
Right, without patches, without aftercare. Right. So I think the kind of guiding principle has to be, if it's not 9 to 5, it's not for workers. And that's I don't even think that's the unfortunate truth. That's just how jobs work. I mean, until jobs change and you want to go change the entire labor market so everyone gets out at 3, ain't happening. Childcare needs to meet families where workers are. And that includes aftercare. I will say that, this effect of you expand childcare and more women work, it is on every possible margin. This is you expand childcare in totality and offer free care. You expand childcare for another hour after school. For some reason, France, I don't know why they do the things they do, they didn't have school on Wednesdays for a really long time. I don't know why they didn't have school on Wednesdays, but then they one day decided, let's do it Wednesday. We're doing it. Kids are going to school. And immediately afterwards, they're like, this is so crazy. Their moms are earning so much more money. And I'm like, I wonder how. Because they have school on Wednesdays. So it is on every margin that every additional hour that a kid is in care is an hour that a parent can earn money. And so if you stop at 3, that means the job stops at 3. That means the money stops at 3. And the job has to be willing to let you stop at 3. So, having to meet the full day is paramount for supporting workforce. But I will say every marginal gain is a gain, at least when it comes to labor force participation of women.
Dr. Edwards, thank you for a great conversation. In listening to all the questions that have been raised, and it seems to focus a lot on money. And what you have asked the question, why is it that childcare has not been implemented the way it's supposed to, right? Well, I have the answer. So, I think that instead of looking at money all the time, it's really important that we as a nation look at what we find important, what we consider important, what in fact is the ethos of the United States of America, right? What is it that's important? This is not a question that has been asked for the first time. Countries like Sweden, Denmark, Norway, Finland have figured it all out, right? And so before our hearts all bubble up in indignation as to why the childcare is not implemented like it is supposed to, I would like to ask everybody in this room whether or not they would like to increase their tax by 10%, right? Because as a nation, and our ethos is, are we thinking that both healthcare and education, for example, and childcare is part of education, is that a right or a privilege? And in the end, when you do an RCA on all of the proximal causes that you and everybody else in the audience has addressed, the more distal, the more fundamental, the more underlying cause is our ethos. Because we do not think as a collective. We think as individuals because we're Americans and we are individualistic. Norway, Sweden, and Denmark are not. And that's why, and Finland, and that's why their childcare systems are very, very good and comprehensive. And on top of that, everybody else in that country is happy, and they pay 70% tax, right? So I ask once again, is everybody in this room willing to pay 10% more tax, including you, Dr. Edwards? Would you do that?
I mean, I got the 2017 tax cut. I'm a rich person. Like I can go back up. I mean, yes. All right. So it is kind of funny that you're like, we can't talk about money. What is the ethos of America? Pretty sure it's money, but pretty sure it's money. But childcare does not cost as much as tax cuts. And that is something that I cannot stress enough. Now, I know this, I'm only familiar with this on the federal level, but the 2017 Tax Cut and Jobs Act cost $2.2 trillion. That is 4 federal child care systems, 0 to 5, stacked on top of each other. We can afford it. We choose not to. So it doesn't come down to whether or not we want to pay more in taxes. It's whether or not we're willing to put our tax dollars to use on children, which for me goes back down to worthiness. It goes back down to why I don't want to help parents who I don't think are worth my drug-free tax dollars. And I think that those countries that you mentioned are more collective, but they also didn't have minorities until 15 years ago. And they were a lot more generous when they were all white, frankly. And it's a very hard conversation to have about who benefits from certain systems and who benefits when we spend money. But one of the reasons why the U.S. is the least generous is because we had one of the highest minority shares ever. And compared to our European counterparts, they didn't have minorities. They didn't let them in. Finland didn't until about 20 years ago when they had a exodus of African immigrants that ended up there. And their public programs became less generous as soon as people of a different color arrived. The U.S., this has always been our issue. This has always been a problem, and we can't pretend like it's not. This is the tough conversation. It's not about whether or not the government is willing to pay for my kids' childcare. It's whether or not they're willing to pay for a single Black mom's childcare.
So a question then is, how do we avoid the issue that when the legislation was placed before Nixon and back to a philosophy of families should look after their children and not the government, even when that's not a fair comparison, but you can hear that comparison. The U.S. has a long history of really not investing in young children, compared not only to Finland, but to Asian countries and African countries. Our history is really not good. The economic aspects that you present are very, very compelling. And the analysis gets clearer and clearer as you show that you have to look at the supply side and the demand side, and there's much to do to prepare for this. And the needs of a 1-year-old or a 6-month-old are different from a 2-year-old and a 3 and 4-year-old. Developmentally, we know how to look after kids. It's putting that into place and integrating with the education system, but all in that, how do we get through the family versus the government piece?
This is a very hard question. And it should be easy. 2/3 of parents need some type of childcare. Why is this so hard to convince our government to give us childcare that we need? It's not as if it's 10% of parents begging like we're some fringe radical group. This is the modal parent, single or married, is putting their kid in care. So I struggle to understand how something like that's the first problem, is that it should be easy because it's the majority of us. That's problem one. Problem two is that there's this myth that women stay home because they want to be there for their kids and no other reason. That they're not pushed out of the labor market, that they didn't have some awful job. I mean, just awful job that paid terrible wages because the federal minimum wage is $7.25, and they don't have sick days and they don't have health care, and they left because the job wasn't worth it. And it not, especially if they had to pay for childcare out of pocket. And what I think there's this myth that women who stay at home are entirely motivated by the care of their children and don't have any economic motivations. And then you offer a free childcare system and it's like, oh, take my kid, right? Like I'm throwing him out of the car. So I think it always helps to, one, meet people where they are, and two, find their consistency. Meeting people where they are is that leaving your kid, even in a qualified care provider, always stirs some conflict amongst a parent, and that there is a duality to how parents view this decision, where I like working, but I don't necessarily love leaving my kid every day, and recognizing that it's hard, and that some days I'm like, God, I would just prefer to stay home, and other days I'm like, whoa, whew, he's in a mood, right? Like there's a duality to how people view this decision, even if it ends up that some of us stay home and some of us work. That conflict is in every parent. Not just every mom, but in every parent. And understanding that and recognizing that is part of the conversation. I think the second part of meeting people where they are is being able to say, like, this paradigm of a family where we have two people married and one's a man and one's a woman, and then the woman stays home and graciously like takes care of the kid, and she's a trad wife or whatever is trending on TikTok right now. Like, it is expensive and you're not paying for any part of it. And the majority of stay-at-home moms are poor, and they qualify for public programs, and they don't have a high school education or a college education. And the stay-at-home mom is a function of economic limitations, not of economic choices. And to say that if they have a choice, you're like, they don't have a choice right now, and you don't know what they would choose if they did. Those are two ways of saying the same thing that ultimately come down to kind of, I think, just being honest with how hard it is to drop off a baby somewhere, but also being honest about how it is an expressed luxury of Americans because rich women always do it. So if they want to come back with the family and say, what about the family? What about parents? It's like, well, rich women don't want to do it. It's just poor women who can't work, who have a job that pays too little. You're kind of just, you're adding family values to an economic decision. And we know it's economic because it trends so much with the income and education of the mom. And so you can make it a family decision all you want, but it comes down to economics. Poor women don't get to work in this country. Not easily. I don't know if that's satisfying. This is one of, I think, the hardest arguments to make because most of the people who make it are articulating something incredibly contradictory, not supported by evidence, not supported by what families choose. So that's hard. I will also say that some of the tougher questions you guys had about, like, what about 0 to 5, like which classrooms kids come in, like how would preschool affect kind of the existing cost market. I think that these are amazing problems, and that I would love to spend years rolling around in the mess of how we distribute free childcare at a cost of care model, then spend another second in this market failure. And it is these are lots of hard questions, but they would be a luxury compared to what we have now. So yes, we don't Yes, it's hard. No, we don't have all the answers on rollout. Yes, it has the potential to be a healthcare.gov. Like, we know that that's a possibility, but it is so much better than the mess we're rolling in now. And so having these questions and having these issues just makes it better when we get it. And not having the answers, that's just because we haven't done it before. But that doesn't mean it's not possible or better.
Thank you, Dr. Edwards. I have not attended all 14 of the Skolnik lectures, but I feel really confident that TikTok has never been mentioned in a Skolnik lecture before. So that's it. You're here. It's a groundbreaking event for Maryland Family Network. I just want that noted for the record, please. Thank you so much for coming. I want to thank you, the audience. We need you to do this event every year. I want to thank Hopkins and the Bloomberg School of Public Health. Comptroller Learman, we are honored by your presence. And Dr. Edwards, you killed it. I am contractually obligated to remind you, please, to use the QR code on your program and take this survey, please. And if you are a child care provider, please take the cost of care survey. If you didn't know how important it was before tonight, I hope we've convinced you how important it was in these comments. We look forward to seeing you next year. Good night.